Hello, everyone. Melissa here. Welcome to your Melissa Moment and welcome to Wellness Wednesday. I have been on a journey with my health, and I feel like I'm at the point in my journey where I need to start researching excessive skin removal surgeries. I've kind of touched on this briefly. I'm going to try to make this intro a little brief because I'm expecting a phone call right now. I have been on the wait list here in Saskatoon for a consultation with a plastic surgeon for, I think, like 9 or 10 months now. On the wait list just to talk to him. I've seen this plastic surgeon before. He's done a tummy tuck on me before, and I'm still waiting. Everything I have researched says that now in Saskatchewan, this type of plastic surgery is not covered at all. It is all 100% out of pocket. So because it is out of pocket, I have decided to broaden my search. And I have come across a plastic surgeon who works out of Las Vegas, Nevada, and Beverly Hills, as well as I believe he has a surgical practice in Dubai as well. He seems to be a very well-respected plastic surgeon in his field. He has created a 360-degree body lift specializing in bariatric patients. So I'm hoping to have a conversation with him today to get some questions answered, to get an idea of cost. That's a big one, just so we kind of know what we're dealing with and we can hopefully start planning for that. So the process was I contacted him through, I called the office, and they sent me an email with a questionnaire to fill out. They also asked for specific photos, which I had done. I sent that back to them. You guys, within not even 30 minutes of me sending them that email response, they had already emailed me back with a phone consultation appointments. Now, they did give me the option of just a phone consultation or a Skype consultation. I don't like technology, you guys. I don't do well with it. I have issues. So I'm like, you know what? A phone consultation's fine. So I'm currently waiting. It's 2:36 p.m. He's supposed to call me at 2:45 p.m. Um, so I'm waiting for that phone call. So what I'm going to do is I'm probably going to see about doing this phone call on speakerphone. That way you can hear both sides of our conversation. Now, of course, I am also going to have to ask his permission to share this with you guys to make sure he's okay with that. Now, when it comes to prices on plastic surgery, it's not a set price. As far as I know, there's no set prices, and the surgeries can also be different prices for different patients. Now, I know that may sound kind of weird, but a tummy tuck for me cost may be different than a tummy tuck for you or your friend. There's a lot of factors they take into account. Age, weight, lots of different things. I don't even know what they all are, but there's a lot of different things they take into account, which can determine the price, right? So whatever he says on the phone, this is kind of just a general thing. This will be specific to me, and where I'm at in my journey and the kind of surgeries he will recommend specifically for me based on the photos that I sent him. Now, like I said, he's in Beverly Hills, so I'm in Saskatchewan. I can't just go into his office. So we're doing an initial phone consultation. We are finding ourselves in Las Vegas in November, so I'm hoping that maybe he'll be in November the same time, or in Vegas the same time we are in November, and maybe I can connect with him in person at his Las Vegas office just to kind of meet him, face to face. Especially with something like plastic surgery, that's not something you want to take lightly. That's not something you want to cheap out on. So I'm hoping everything goes well with this consultation today. I'm hoping he gives me some answers, and at least I can come up with a plan of how much it's going to cost, when's the best time for me to do it, how many surgeries I am looking at, and just to get his expert opinion, because obviously he's the expert when it comes to this kind of thing. He's been doing it for, I think, over 25, 30 years. So he has a lot of experience, especially dealing with bariatric patients, which is important to me. I feel like I'm rambling a bit. I always get so nervous when I'm waiting for phone calls and stuff. I don't know why, especially something this long distance. I always get nervous because technology does not always work with me, and I worry that like we're going to get cut off, or my battery's going to die but it's at 100%, or I'm worried that someone's going to come to the door, or who knows. I get nervous, I get anxious. I don't know if it's just me. I've got some iced tea here in case I start like choking uncontrollably, because that's been known to happen. I'm going to try to be calm, not crazy. Yeah, we'll see what happens. This is a big thing, though. This is a big thing in my journey. I have a list of questions that I've written down here. So hopefully I cover everything that I need to know. This specific doctor does also have a lot of social media presence, which is nice. You can view his website. You can view photo galleries of surgeries he's done, before and after pictures. You can view, he does Facebook Lives right from the operating room doing surgeries. He's been on the Learning Channel on a few different TV shows as an expert. He seems like he's really out there in the public eye, which to me shows a lot of confidence and a lot of experience, and he doesn't have anything to hide, which is great because there are a lot of plastic surgeons out there. Obviously, some better than others. Some specialize in different areas of plastic surgery. You really want to make sure you're finding someone that you're comfortable with, and that you feel confident in, because at the end of the day, you are going under anesthetic. At the end of the day, they're cutting you open and they are transforming your body. You want to make sure your results are going to be good. And if for some reason there's an issue, you want to make sure your surgeon is willing to fix whatever the issue happens to be. Now, obviously, they can't tell you exactly what you're going to look like after surgery. Everyone heals differently. Everyone's body's different. Everyone reacts differently to surgeries and recovery. So it's almost impossible for them to tell you exactly what you're going to look like or exactly how things are going to go. But they should, especially with someone with this much experience, have a general idea of which surgeries they would recommend and what the possible outcomes of those surgeries will be. So we're going to find out. We're getting close to crunch time. According to my clock, it's now 2:42. We're 3 minutes away from when he's supposed to call me. This will also be good to see if he's punctual or not. I always like to, anytime someone's supposed to call me, I always keep track of, do they call on time? Are they early? Are they late? How early or late are they? I mean, he is a surgeon. He is a very busy doctor, I assume. But so far, I've been very impressed with his employees. I haven't chatted with him yet, but his receptionist or office administrator who answered the phone when I initially called was very lovely on the phone. The email correspondence I have had with another one of his employees has been very quick and efficient. So far, I don't have any red flags. They seem like they're doing great with customer service, which is a big thing for me. But as I've mentioned before, I do find customer service and professionalism much higher in America than it is here in Canada, especially where I live in Saskatoon. So that's always a good thing. So that's another reason I'm kind of looking to go out of country, because I've had a lot of experience with our healthcare here in Saskatoon, Canada. And let's be honest, guys, there's a lot of room for improvement here. Lots. So Let's see what America has to offer, shall we? Especially since it's out of pocket, right? That's another thing. They're in America, so any prices he gives me today, USD, right? There's going to be that exchange rate in there. So I'm just going to get my thoughts together, wait for this call. 2:44, we're 1 minute away. Let's see. That all sounds really good. Um, Now, obviously, he wasn't one to give prices over the phone, which I can completely understand. He's the surgeon. He has a whole team that works with him to do those types of things. So, like I said, his office so far has been really good at getting me emails and stuff quickly. So I'm looking forward to that email today, and I will share with you kind of what we're looking at. So yeah, just to go over it, he recommends 3 different surgeries. Okay. Those all sound good. I agree with all of it. Part of me is the fact that he said we don't necessarily need to do a augmentation, just a breast lift. That's intriguing to me because here in Canada, as I had mentioned on the phone to him, my surgeon here said they would do an augmentation with the lift. And he's saying, I don't think you need that. I think you're going to be too big if we do that. So that's good. Not saying that my plastic surgeon here or other plastic surgeons in Canada aren't as good, but for whatever reason, I do kind of put a little bit more confidence in American surgeons. So that's all good. Recovery time between surgeries only a month. I agree with him. Like, I think he'll probably take a little more time than that. But again, that all seems pretty good to me. The only hiccup that I think I'm going to have is the fact that they want me in Los Angeles for 10 nights. That's going to be difficult. And that's for the 2 out of the 3 surgeries. He said the arms and breasts, I can go back to Vegas, not a problem. But when it comes to the full body lift and or the thigh lift, they want me in LA for 10 nights. That is going to be expensive, right? So that is going to be pricey. We'll have to kind of figure that out as well, the cost issue, just because, like I said, this is all out of pocket. Our Canadian government doesn't cover any of this anymore, which I think they should. At least a portion of it, I think, should be covered. I also think if they had coverage, more patients would be getting their plastic surgeries done right here in Canada. The fact that there is no coverage, I think a lot of us, we're going to other countries to get this done. Because we can get in quicker and we're paying out of pocket anyway. That's one of the reasons I'm looking at going out of country. I definitely like this doctor. I really am impressed, like I said, with his videos and his website and his before and after photos. I'm really excited that he's considering taking me on as a patient. I have lots of information here. Now we just wait for that email. We make sure before we open it, we're sitting down, because I guarantee you the cost of these procedures are not going to be cheap. And like he said, this cost does not cover travel, accommodations, food, right? So I'm going to have to figure this out. The other scary thing is I might be in LA by myself for the recovery. That makes me nervous because these are big surgeries. And if I need help doing things, I won't have anyone there. The only other thing I can do is ask my husband and daughter to come with me to Los Angeles for 10 days, which I'm sure we could find a way to make it work, but that's asking a lot because obviously he has a day job. you know, and if they're in LA, they can't just stay at the hotel with me the whole 10 days. They're going to want to go out and do things, and I will not be able to. So it's going to be tricky. It's going to be tricky to navigate. I think that's going to be the hardest thing to try to navigate is the accommodations in Los Angeles. I'm also not a fan of Los Angeles. I think I've mentioned that when we went there for Disneyland. LA is a different breed. Let's just say that. It's different. But I'm excited for the possibilities. I'm excited to have this information. I'm excited and nervous for the quote. Should we put some guesses? Let's finish this video with guesses, you guys. Based on what he said, okay, 3 surgeries, all right? Breasts and arms is surgery number 1. Surgery number 2 is the lower 360 lower body lift. Surgery number 3, thighs and butts. What are we thinking for prices here? You can give me individual prices based on those 3 surgeries, or you can give me an overall price. What are you thinking? If I had to guess, I'm going to say all three surgeries, all 3, you guys, I'm going to say $100,000. That's what I'm going to say, $100,000. That doesn't include the accommodation, the travel, or the food. That's just the surgeries, the compression garments, the medicine, the care from the doctors. $100,000 for all 3. That's my guess. I think I went high. Well, no, I don't think I went high. I think I'm pretty close to what it's going to be. If it's more than that, you guys, if it's more than 100,000, I don't know what I'm going to do. On principle, if it's more than 100,000, I think I'm not going to do it. That's too much money. I mean, $100,000 is a lot too, but I can find a way to make $100,000 work. More than that, I could buy a house. Like, I mean, maybe not. It'd be a good down payment on a house. Oh, you guys. Okay, did you put your thoughts in the comments there of what you think this is going to cost me? Whether you think overall, give me an overall price or an individual price on 3 surgeries. Interesting. It's interesting. Okay, so 3 surgeries. I thought it would be 2. He's saying 3. It's a lot, you guys. The nice thing is 3 surgeries, you know, we can save up money, get the 1 surgery done. And then we can save up money, get the 2nd surgery done. And then we can save up money, get the 3rd surgery done. I honestly think the 1st and 2nd surgery are going to be the most important. The arms and breasts, that's going to be really important. And then overall, the body lift. Those are the 2 surgeries I'm most excited about. The thigh lift and the butt lift, I'm excited for those, but I'm okay waiting on those because I can hide my legs and my butt with clothing, right? The arms are hard to hide when it's summertime and you want to wear a tank top. And the breasts, depending on what outfit I wear, you know, with bras and stuff, it can be hard when you're trying to dress up nice. So that one's important to me. And then the whole lower body lift, I mean, that's just tucking everything. I think that one is going to probably show the biggest impact overall. So we'll see. We'll see what it says. Thank you guys so much for watching my journey, listening to everything. You know, the doctors have been saying, I've been thinking about. I really appreciate your support. this journey is far from over. We have a long way to go still, but I'm excited. We're at the next phase. I'm excited that this doctor thinks I'm ready for these surgeries. He doesn't feel I need to lose more weight. He feels that I'm ready even after these surgeries. If I end up losing 10, 20 pounds, he doesn't think it's going to impact these surgeries at all, because that was one of my biggest fears, is doing these surgeries too soon, losing more weight, and then having to redo them, because we want to avoid that at all costs. So I love that he thinks I'm ready. And I'm excited. I'm excited for this next phase. So I don't know when we're going to get to this next phase, but we have some answers. We can plan, we can organize. That's important to me. So thank you guys so much for watching this Wellness Wednesday. Someone's driving by my house. So thank you for that. And again, if you guys are interested, I'm going to continue to do follow-up videos here on all that kind of stuff. Next Wednesday, I'm going to share with you probably the prices. So if you're intrigued as much as I am, make sure you have subscribed and click that notification bell so you do not miss next week's Wellness Wednesday. I will also tell you my conversation with my husband about this, and see what plan we have put in place to make this happen, hopefully, or to go a different route. So thank you guys so much for watching. We'll see you next time.